What are other examples of issues that we see of people who are getting, quote, black market hair restoration? What kind of things are we seeing that could be a problem?
Well, the big thing for me is we all know that supply back there is finite. So you only have so much hair to give in your lifetime. And when we're talking lifetime, I mean, we're here for a long time, hopefully, and hair loss is progressive. And so where you are in your 30s is probably not where you're going to be in your 50s, is probably not where you're going to be in your 70s. These are all snippets in time. So on my end, when we talk about the harvesting, I hate when I see over harvesting because that limits what I have for you in the future. And we know that hair loss is progressive, so probably eventually you may need something else. And if all of that is taken, I have nothing else to give you. The patient that I saw who was over harvested was significant. He actually looked thinner in the back than the transplant site, which then that is also a little confusing to the eye, just aesthetically. It doesn't really make sense. This part shouldn't look thinner than the top of your head.
Absolutely. You can imagine if you're going to another country for a hair treatment, chances are you're going to go once. You're going to fly across the ocean one time. And so they have no concern about your general future, right? They just know they have you in front of you right then and there. And so one of the things that we battle with big time is that these places will advertise doing 5,000 grafts, 6,000 grafts. And then they show a before and after. And quite frankly, we don't even know if that before and after is legitimate. I can tell you that I can tell that the vast majority are not legitimate because I know what can be done in surgery on one single round and the success of what it takes and what you can do. I do it every day. And so I can just tell you the things that they will show are not realistic for a single round transplant, but they will advertise it and they'll say they took 5,000 grafts. And I can tell you, Lindsay and I are pretty damn fast. We have gotten very efficient in our hair restoration practice. We've been doing it for years. And even, again, no surgery do I think that you want to be the fastest because that itself is not a signal of success. But I do think efficiency is something that you certainly look for. And I can tell you that we are very efficient. And just to do simple math, the biggest transplant that we will offer in one round is 2,000 grafts. And again, keeping in mind that Lindsay and I do this all the time and are efficient, that 2,000 graft transplant will take an entire day. A patient will arrive around 7:30 in the morning and they stay till about 5 o'clock in the afternoon or evening. It means the person has been in the chair for 10 hours.
A long day.
That's 2,000 grafts, right? If they legitimately are doing 5,000 grafts, number one, they're either being exceedingly sloppy, and who knows how good the grafts are even being done, or they're really not, and they're charging you for 5,000 grafts, and you're not really getting 5,000 grafts because it's impossible, even in the best hands, to do that kind of work well in one day. Impossible. So overharvesting is a problem. It's a problem because just like Lindsay said, we've got no backup for you in the future. You probably wasted tons of grafts that you didn't need, and now they don't grow back. So you come back, and if there is a problem, we've got very little to work with if they've actually harvested you in that way. And how could they do that? Super, super, super fast and sloppy, and they ruined half your grafts. There are stories about them having multiple people at your head. But again, in the best hands, in the most professional hands in the United States, we really, really look down on doing more than 2,000 plus grafts at once because we know that you only have so much in the back and we don't want to waste all of that beautiful cell work that you have back there that we could use in the future. So it's just not the right thing to do. I just came back from the International Society of Hair Restoration, which is the proponent in the best and most advanced hair restoration surgeons in the world. Interestingly, this particular country that people go to, there weren't anybody from there. And I thought that was really shocking because these are the best people in the world coming together to communicate, how to best transplant. And that goes to our next part that we'll talk about is, how do you tell if someone's even legitimate or not? But the other thing besides overharvesting that we see is bad anatomy. So whenever we draw out your hairline, you might have an idea as to what you want, but we're going to draw out a hairline that is anatomically correct. And if you are transplanted in an area, in a place that doesn't really follow the anatomic lines, you're going to look terrible. You're going to look like you had a transplant, which is never what you want. And for Lindsay and I to fix that is really complicated.
It is, and I think the other thing that you particularly do very well as part of that is the planning of their lifelong progressive hair loss. Your design takes into account what may happen in the future,
Right.
what's happening now.
Right. And if you don't do that, again, we're going to find you back in 10 years looking crazy. And again, a place that's going to only see you one time. And it just happened. Unfortunately, they just don't plan ahead. And so we're seeing this. My colleagues at the ISHRS talked about this. It's actually a thing now where we're trying to fight this fight of like, please understand that the marketing out there may look like there is some magic happening in other parts of the world, but you have got to do your due diligence, because if it sounds too good to be true, I am telling you it is too good to be true.